is a great pleasure to share this panel today. We're honored to have Madame Ambassador of the Swiss Confederation. And this is a big accomplishment for us. Just let me know that you can be with us today, sharing your perspective, your opinion on the health system in Switzerland. So thank you. And please correct me if I'm saying wrong your last name. We sometimes get confused. Probably this is not the first time for you that you have heard this. Rita Hammerli.
Perfect. Yep.
Thank you. So also we have our special guest today from what it is not just me saying this or as Equus saying this, that the best private hospital in Ecuador, but it is probably one of the best on the region in South America. We're talking about Hospital Metropolitano, and we have with us today the person who is in charge of the Department of Operations and the administration of the quality and making sure that things are working properly at Hospital Metropolitano. And you probably are familiar with it if you have gone to Quito or you have any medical appointment in there. So we're talking about Mónica Lana Moreno. She has a extensive experience and a good background on her education. She went to Harvard University, and she got a postgraduate in medical management services. So just to give you an idea of who is going to be talking to us today. And also we have Caridad Ramirez. She's the commercial manager for Hospital Metropolitano. Caridad is going to be talking to us from the perspective what the hospital, what they do, and especially their plans. Something that I would like to make that is remarkable about Hospital Metropolitano, especially Caridad, it is that she was in charge of the program where they have, which is Metro Fraternidad. It is like Metro Fraternity, which is basically they work with from the social perspective, helping people that they don't have the resources. And I have the great pleasure to listen to today one of her interviews. I think this was from back 2012, and they were explaining about how kids go there and so grateful they are. So one of the reasons we decided to have them invited, it is because not just for the quality of their services, but they also combine what is the social side of their services and also their quality, as I said. And we have today also Joshua. Joshua, you are here too. So Joshua will be helping us with the questions from our panelists. Basically, you know how we start. We have this, and we have our attendees, which basically it is the expat population living here in Ecuador. And I just want to remind you, like, feel free to make your questions. We're going to be reading them. And what if we start with a Caridad presentation right now? So Caridad, could you please talk to us about what Hospital Metropolitano is doing right now? I know COVID-19, it has been a challenge for everyone, not just here. We can see on the news, New York City, Italy, there's some real problems on the healthcare system. So what if you start talking to us about what Hospital Metropolitano is doing right now.
Okay, thank you, Marcos, and hello, everyone. Thank you very much for the invitation, and thank you very much for that great things that you said about our hospital. In fact, we are the best hospital in our country, and we are very proud to hear that. So I am going to begin to talk about the healthcare in Ecuador and to understand what is happening now. For all of you that decide to live in our country, welcome to Ecuador. We are a beautiful country, and I would like to introduce about us, Monica and me. Monica Lana is our Operation and Quality Assurance Director. She is saying hello, maybe now. And then, how about me? I am the Commercial and Customer Services Manager. In fact, in the past, I worked here in the hospital for our social responsibility program, and now I am in the commercial area. So why we are here today is because we are going to explain about Ecuadorian healthcare system, Ecuadorian private healthcare, and about Hospital Metropolitano. What are we doing, especially in this moment, in these difficult moments? In Ecuador, this is our health systems. Let me see the screen. I cannot see. We have the 66% of hospitals or health centers are private in Ecuador. 28% are public, and 6% are no-profit service centers like foundations. Especially in private health centers, 75% of these centers are general hospitals without any specialties, and 17% are basic hospitals, 5% are general hospital with specialties like Hospital Metropolitano. What happened in Ecuador about the morbidity? The first of all are the maternity issues. In fact, maternity is not a disease, but we like to have children in Ecuador, so we have a lot indicator about maternity. Then people has appendicitis, gallbladder, pneumonia, diarrhea and gastroenteritis, and urinary systems problems. In Ecuador, we have, like I said, private institutions, public system, social security hospital, this is for workers, military and police hospitals, district hospitals, and Solca Cancer Institute is like the big center for cancer. And Solca has a public side and a private side. I would like to show you very quickly about public hospitals in Quito. We have all these pictures are from these public hospitals, and maybe you have heard a lot in this time about because they are receiving COVID-19 patients. And the private hospitals in Quito are those: Clínica de la Mujer, especially for women, Clínica Internacional, Clínica Pasteur, and then Nova Clínica, and the hospitals, private hospitals, is Hospital de los Valles, Hospital Los Andes, and Hospital Metropolitano. Another important city is Guayaquil. Unfortunately, Guayaquil is having very, very bad days about COVID-19. They have these Clínica 𝐒𝐲𝐬𝐬, Clínica Kennedy, Hospital Kennedy, and Omni Hospital. Guayaquil is a beautiful city, and really we all want that Guayaquil is going to be, we want that Guayaquil be again very well. Then we have private hospitals in Cuenca. Cuenca is the third most important city in Ecuador. We have Hospital del Río, Monte Sinaí, Clínica Santana, and Hospital Santa Inés. Cuenca is a very wonderful city. I am from Cuenca. And it's a romantic city with beautiful rivers. Some people say that it's an European city. Okay, let's talk the private world in hospitals here in Ecuador. We have all the principal insurance companies for health. Here, Hospital Metropolitano works with this, especially with this insurance company. And we have a special agreement, and in that way, when somebody comes to our hospital and this person has these policies, we can accept the credit and we can attend this patient, and then this company pay the bill for the patient. This is what our wonderful hospital, Hospital Metropolitano, 34 years in Ecuador. This is a fantastic view from one of the medical buildings, and this is our strategic statement. Because we love life forever, because we do that, we seek to take care of your well-being and then of your family, leading the transformation of health service. We do it with the best quality, security, and warmth through an organizational culture based in the personalized human care. And now we are really very taking more than ever this special care for our patients. This is our values: excellence, security, integrity, quality, respect for the human being, warmth, and efficiency. This is very important because we are the unique hospital in Ecuador with this accreditation due to compliance with international safety and quality standards in patient care. We have this accreditation for 3 consecutive times, and in this year we are going for the 4th accreditation. But we have to wait a little bit because all the world is stopped. We are a big hospital. We have more than 30 medical specialties and subspecialties. This is some of our facilities in Quito. I don't know if you sometimes came to Quito and know the hospital, but this is one of our private rooms. This is an exclusive floor in the hospital. This is a private room. This is our pediatric floor. This is our emergency room. This is one of our operating room. We have 16 operating rooms. They are very complete technology and very good equipment in there. We have linear accelerator for cancer treatments. And now we have the robotic surgery with 𝐷𝐻𝑉. We are the unique hospital in Ecuador that has the really 𝐷𝐻𝑉, the really robotic surgery. This is our laboratory with the best quality and a radiology area. We have the angiograph, especially for heart attacks, catheters, and we have 3 medical towers to connect it, that connect directly to the hospital. We have 3 buildings: the medical towers, Metrópoli, and Centro Médico Metropolitano, with all the doctors, office doctors. So what about the pandemic and the COVID-19? I am going to introduce you again to Monica Lana, my colleague. She, in fact, is going to have a better English like mine. And Monica, maybe you can tell to our friends about what we are doing about this terrible pandemic and the COVID-19.
Okay, good afternoon, everybody. Thank you for the introduction, Caridad, and thank you for the introduction and the invitation, Marcos. Very pleased with the presentation of our hospital. Perhaps we can start telling you that we are very concerned with what's going on in the entire world. This pandemic has really made us really concentrate more than ever on our patient safety, and especially not only the patient safety, but the family, our visitors, our employees, our physicians, and we have done many things to implement a contingency plan in order to keep all the doors closed and all the facility as safe as possible. Let me start telling you that the hospital has clonated, really. We have created 2 hospitals in one. We have separated the hospital, the COVID hospital, which is 200, about 250 meters away from the main building. And what we have done is we have created these 2 particular hospitals with all the services that we think the patient with COVID needs. We do have hospitalizations. We have ICU, intensive care unit. We also have operating room. We have a delivery room. We also have all the radiology equipment, such as, for example, TAC or tomography, as you may know, conventional X-rays. We have our own separate team of employees, nurses, physicians, specialists, who are taking care only to those patients who are suffering right now with the COVID virus. So that is to give you an idea of what type of infrastructure we have and what type of planning we have done to be able to have 2 separate hospitals. The idea of having these 2 separate hospitals, it's really to deliver the safest care that we can possibly can. Therefore, that is one thing to take into account, that we do have all the services and we have them separate. Therefore, preserving the safety in regards to those patients who do not have COVID. We have in our main building, of course, all the services. We continue to provide all the services, the emergency room, the lab, radiology. Even in the emergency room, we have kind of developed different flows of care. We do have in the outdoors of the hospital, of the emergency room, we have a container. And this container, I think that's it. This particular container has, as you can see, it's a pre-triage area. That means that any patient who comes into the hospital will go to this pre-triage area, and here we will decide whether the patient has to go to the COVID area, or if the patient does not have any respiratory symptoms, he will be taken directly to the main building. This pre-triage area, it's nicely equipped with all the things that we need: a physician, a nurse, and all the, the vital signs takes place in this particular area. And we think it's the safest way to treat our patients. We do have an emergency room for non-COVID patients. And we also have, right here, this is it. And we also have an emergency room for the COVID patients, for those patients who have somehow explained to us that they have some respiratory symptoms. As far as the test to be done in our lab, we are developing right now the facility to take the quick test or the rapid test they know in the market, as well as the PCR test. Therefore, we are encouraging, not encouraging, more than it's a mandatory fact that all our patients who come for invasive procedures or for surgical procedures or even clinical hospitalization to have the PCR taken before they come into the hospital, of course, except in cases of emergency, in which we will determine by the clinical symptoms whether the patient can be admitted to the COVID or to the non-COVID area. As you can see in the picture, we have established the screening questions as any other hospital. Temperature taken in all the main entrances of the hospital, as well as the employees. And we have these green things that you see on the floor, which are antibacterial rugs for the shoes. Although it's not confirmed or has 100% evidence that the shoes have to be clean, we have really implemented extreme biosafety measures. I don't know, Caridad, if you have a picture there with how the people are dressed and how our employees. Oh, this is the main entrance, the admitting office. All the cashiers have been provided with films, some acrylics, some glass, just to keep the social distance between the patients or the potential patients and our employees. Well, these are few of the things that we have done. As far as biosafety, we have done interesting things, such as marking the floors as to keep the 1 meter and 1.5 meters. Our cafeteria has signals as where to sit down. Our coffee shop as well, we have separated as far to keep the 1 meter, even 1.5 meters apart. Our elevators have a system so that you will not touch the floors, or you will not contaminate your hands. In other words, we have alcohol dispensers everywhere in the hospital, facilities for hand washing, of course, and those are the few things that we have done as far as keeping the biosafety measures. As I said before, in the outpatient departments, we do have a screening questionnaire. Even though you said you're not COVID, we're still going to ask, and we're still going to take the temperature just to be on the safe side. I guess that's about it. We do follow, of course, all the biosafety rules of the CDC, which is the Center for Disease Control, which functions in Atlanta, Georgia. Not now, I think all the time, throughout the time. I have been 34 years in the hospital, and ever since the hospital opened its doors, quality and patient safety was our mission, always. Now, I guess with this pandemic situation, it is more than ever. At this point, I really don't know if you have any questions. Some information, yes, Gary, you can take over.
Yes, there's a question, but I don't know if the moderator is going to ask you. But just to end the presentation, I would like to say that Ecuador is still a great place to live. We are sure that we are going to separate this. I would like to show so many special pictures of our wonderful country. This is our jungle. This is our Galapagos Island. This is our beaches. And I think soon everything will be fine, Thank you very much for your attention. And now we are going to respond to your.
Yeah, thank you, Caridad. Thank you, Monica. Thank you so much. Actually, I have a question for you, because I have been a presenter in some international panels where with some people, they're seeking to retire overseas. Specifically, in the last presentation, I was in Belize, and those are the one of the biggest concern about a whole care system. Because, for example, one of our competitors for our attendees, places where to go and retire, go to invest, it's Panama. Panama right now, it is under they have the project of a construction for an affiliated for Johns Hopkins. And my question goes to Ecuador and Hospital Metropolitano. Where are your international standards? And that's one of the reasons we have Madam Ambassador here, because Switzerland is well known to implement some of the standards on the world, but in quality services. And could you please explain us your international standards or Ecuadorian standards? Because as Hospital Metropolitano, you are leaders in Ecuador. Although CUENC has a great healthcare system too, but Metropolitano, it is. So could you please, Monica or Caridad?
I think Monica.
All right. Thank you for the question, Marcos. And let me just brief you a little bit. Ecuador has local regulations. Every single hospital, private or public hospital, and especially the private hospitals, we do have to follow regulations and norms as far as auditing is concerned in regards to safety and safety matters in patient care. There is not a licensing process, but there is a permit, an authorization to work or to open up to their services to the public. So that's the first filter, I can say, in all hospitals in Ecuador, public and private. However, as Caridad mentioned to you, we are the only hospital in Ecuador who has achieved, very, very proudly, of course, the standards, the United States standards of care. They're not only United States, it's international. Many European countries, many countries and everywhere have joined Commission International. Well known in the United States at the hospital, is the Joint Commission Hospital Organizations. But for international purposes, it's called JCI, which was created about 15 or 18 years ago. And it allowed countries, foreign countries, to be able to accomplish international standards. There are 1,133 measurable elements that when the people from the Joint Commission come to see our hospital, it's a checklist of accomplishment. It begins with hand washing. It ends up with quality assurance in surgeries, quality assurance in radiology, nursing care, patient teaching, family teaching, safety as far as the infrastructure, fire safety. It involves, it's a 360-degree evaluation of the hospital. Within this, we have 300 policies, mandated policies by the Joint Commission. As I said, they give us all the guidelines as far as what has to be accomplished, and in a scale from 1 to 100, they come every 3 years. They do an auditing session. They do auditing sessions, 18 months with a traceability of 18 months, and it's mandatory to accomplish at least 85%. Some of the policies, such as, for example, the patient safety, patient identity, patient falls, nosocomial infections or acquired infections in the hospital, the achievement has to be 90 degrees. Medication errors, you name it. It's a 360 evaluation. And what they do is every 3 years, 3 and sometimes 4 auditors, physicians, nurses, infrastructural engineers, they come and visit us. And they do a 5-day stay, complete 12-hour day of evaluation. Just making sure that we are complying to their international standards. As I mentioned before, even the credentials, They come and look up the nurse's credentials, the physician's credentials, and it's nice to be able to say that a majority, more than 50% of our physicians were trained in the United States and Europe, okay? So that is a plus. These particular physicians are used to these international standards. So that is also to our advantage. We do have a very, very strong training programs in the hospital. And we also are very proud of our organizational culture as far as measuring everything, as far as looking for clinical expected outcomes. For example, let me give you an example, which is, I think we are the only hospital, and not only in Ecuador, very few in South America, that we measure clinical expected outcomes. That means that, for example, let me just give you an example. In surgery, we measure and we follow up how many surgeries we do, how many complications we have, how many infections from the surgery, how many people died, we call mortality, and also we call morbidity, how many people end up with another disease that they didn't come with. So these parameters, this criteria, it's well established by the Joint Commission, and we must comply to all these requirements. Another example that I can give you, and perhaps you're more familiar with it, it's cardiac patients. As in the United States, as in Europe, we measure, we have what we call KPIs, key performing indicators. And we measure the times. We measure the time from the patients, when the patient steps into the emergency until the electrocardiogram is done. From the minute that the patient steps into the emergency until we call the needle. That means that somebody is taking care of them in case of an infarct, okay, a cardiac infarct. So these things are what we call the international standards.
Okay, all right. Thank you. Thank you so much for your answer. And I would like to continue with Joshua, Madam Ambassador, just give it 2 more minutes and to answer the next question. So Joshua, could you please help us taking just one for now, and then at the end, we will continue with the rest of the questions. Sure. Please.
Yes, indeed. Okay, so a very interesting question from Heather comes. She says, if a patient comes to the emergency room and is examined in the pre-triage area and doesn't have respiratory symptoms, how are you screening for asymptomatic carriers? Because there are a large percentage of COVID-19 patients that are asymptomatic.
In the pre-triage area, what they are going to do is they are going to assess respiratory symptoms, okay? If they are non-respiratory, there is no respiratory symptoms, there is no need for further testing unless you have, let's say, the main symptoms, cough, dry cough, the loss of sense of odor, the loss of sense of taste, diarrhea, temperature higher than 38. Now it's the latest, it's fatigue, and so on and so forth. So there is going to be a physician there and the nurse who are going to question. They are going to make many, many questions. If there is a slight suspicious of a respiratory problem, immediately they will send you to the COVID area where the testing is going to be done, whether it's the quick testing or the PCR testing. Our laboratory has a system in which the PCR, we don't have to wait for the PCRs for 6 hours or 8 hours as they usually do. We have the results in 1.5 hours, the PCR. And of course, the quick test is rather quickly. It's in less than an hour or so. Okay, and we do it. They will do it by 3 methods. They will do it through your nose with which is called the nasopharyngeal. They will do it oral pharyngeal, and they will also do it in blood. okay? So it will be accordingly. That is up to the physician, really, okay?
Okay, thank you very much.
Okay,
Marcos?
thank you. Thank you so much. I would like to continue with Madam Ambassador. As I said at the beginning, it is an honor that you are here with us. And one of the reasons how we make the plan and having this meeting today for our expat community living here in Ecuador, it is to have a different perspective of what other things are being doing in the world. I know no countries are far from, dealing with this issue right now. So what is happening in Switzerland right now, and if you can tell us more about how the healthcare system works there. So welcome.
Thank you very much. And thank you for inviting me to this program. Hello to everybody listening. I prepared the PowerPoint, so I'm not sure it should be showing up.
Yes, Ramina, if you're listening this, yes, you are, but so could you?
I have to stop, I think.
Okay, all right.
Okay. Okay.
Yes, exactly. So maybe we go just to the second slide. Before I enter into the measures for COVID in Switzerland, I want to explain you the Swiss healthcare system, the cooperation we do between the different players, and a few phrases about the collective agreements we have. And then we go to COVID. Next, please. In 2018, the EuroHealth Consumer Index, measured about 40 different indicators in different health systems in whole Europe, and Switzerland came out first, which we're of course very proud of. Next. Switzerland, as you may know, is a small alpine country with a population of about 8.1 million people and 4 official languages. In 2018, Switzerland had the second highest life expectancy among OECD countries. Only Japan enjoyed a higher life expectancy than Switzerland. Like many other countries, Switzerland faces an aging population. Swiss people feel healthy, yet non-communicable diseases account for more than 85% of the burden of disease in Switzerland. They are responsible for about 80% of total health expenditures. 2.2 million people are affected by chronic non-communicable diseases today. Many people suffer from more than one chronic condition. Similar to many of its neighbors, Switzerland's most important causes of mortality are cardiovascular diseases and cancers. Next, please. So I said we have the best healthcare system in Europe, but also one of the most expensive systems in the whole world. According to the OECD figures, Switzerland is at the second place for highest health expenditures. Measured by the GDP, we are about 12.2% of our GDP, which spent on health. We are closely followed by Germany and France and Norway. And of course, the first rank is by the US with 16.9% of GDP. Political countermeasures have so far concentrated mainly on patients, higher cost sharing, hospitals, independent doctors, and the pharmaceutical industry. If there is an interest, I can also enumerate more reasons, but I think we don't have the time to go into all the details. Next, please. Every health system is the result of an evolutionary development. Each country has its own history, which led to its current health system. In Switzerland, federalism is a key element of the health system. The central element of the federation is the subsidiarity principle, which gives all power to the cantons, except in areas where the constitution has explicitly assigned competencies to the federal level. Health is one of the key areas where cantons have many competencies. This has led to the emergence of different patterns of healthcare provision and financing across the country. Today, as the result of a slow but steady process of greater centralization over recent decades, the federal level plays an important role in regulating most areas of health system, and that's also the base for cost regulation. Next, please. I'm just jumping on this slide because it goes a bit into more details about our different competencies. But I think I prefer to have some more time for Q&A, so we just go to the next. The Swiss healthcare system regulates relations in the healthcare system between insurance companies, insured persons, service providers, and other involved groups in Switzerland. It is typical of Switzerland and, for historical reasons, has a federal structure throughout. Since 1996, every inhabitant in Switzerland, locals and foreigners, has compulsory basic insurance and pays monthly premiums to a health insurance company of his choice. There is therefore competition between the insurers. Premiums vary according to the insurers and the canton of residence. Important to know is that health insurance is a head premium. Don't have a family cover like in many other countries, it's per head. Premium reduction based on taxable household income is possible. We have no state health insurance, all the insurance are private companies. Every insurance company is legally obliged to accept any residents for the compulsory part. Even if you have a precondition, they have to accept you. For supplementary insurance, they don't have this obligation. They can refuse to insure you for any additional possible insurances, but the compulsory part, they have to take you. Next, please. So the compulsory health insurance provides cover for illness, maternity, accidents, and offers the same range of services and benefits to all insured people. Insurers must ensure equal treatment for everyone, making no distinctions on the basis of health status or indicators. This applies in particular to enrollment, the choice of insurance type, and reimbursement of costs. Compulsory health insurance is financed by policyholders' contributions, premiums, and co-payments. That goes a bit hard to explain everything, and federal and cantonal funding. Premiums are not dependent on income and vary according to insurer's place of residence and type of insurance selected. People on low income, children and young adults in education often receive premium subsidized from the cantons. Entitlement to subsidies is determined by the canton of residence. That's why it's really federal. Everything is always different from every canton. People are free to choose any insurance operating in their place of residence. Within their area of activity, insurers must accept any person subject to compulsory insurance. Then we have providers can be compensated for their services in two ways: by policyholders who are directly paying the bill and then get reimbursed by their insurer, or directly by the insurers, which is the most often applied case. When you buy in a pharmacy your medication or you go to the doctor, it's directly paid by the insurance. And something which might surprise is that dental treatment is normally not included in the benefits catalog. You can buy a compulsory insurance for that, but not in the basic package. Let's go to the next. Important to know in our system is also hospitals are financed by payment of treatment by the patients and the insurance companies, but mainly by subsidies from the cantons. The canton of residence normally takes about 55% of the costs, and the health insurers usually maximum 45% of the costs. Private hospitals, on the other hand, are usually financed only from treatment charges. And usually that's then more expensive. For accidents, we have a different system. Every employee is insured compulsory for the treatment costs of accidents by the employer, who is having the policy with this SUVA, with this Swiss General Accident Insurance. And somebody who is not employed can have private accident insurance, or can also take an accident insurance with the health provider, with the health insurance company. Next, please. We go very shortly now to the how doctors, the payments, how this working, the tariffs, medical tariffs we have in Switzerland. That's why I have the slide here for doctors. We have quite a high coverage of practicing doctors and a high density of specialists in Switzerland. This is also one of the reasons why we are so expensive. Next, please. The prices of medical treatment are strictly regulated. The TARMED structure is a project of the Association of Swiss Doctors, Swiss Health Insurers, Swiss Hospitals, and the Federal Social Insurance Institutions for Accidents. The tariff partners introduced TARMED on 1st of January 2004, since when it has been used for billing outpatient services in doctors' practices and hospitals. Next, please. The tariff system, which was, as I said, introduced on 1st of January 2004, assigns a certain number of tax points to each medical service. In theory, this would mean that the medical bill will be the same throughout Switzerland. However, the tax point value was set differently in each canton, so that one and the same treatment can vary from canton to canton. These differences are justified by the different incomes, cost structures, physician densities, and mentalities in the cantons. Next, please. In addition to the aforementioned TARMED, which counts only for outpatient treatment, we have a per case flat rate system for the hospital treatments. This was introduced in January 2012. In this system, treatment cases are combined into groups. For example, correction of a cleft lip and palate in small children that are as homogeneous as possible in terms of medical and economic criteria. Each hospitalization is assigned to such a case group based on medical and other criteria. These case groups are identical throughout Switzerland. Next, please. People in Switzerland have a high life expectancy and good access to healthcare. But increasingly often, they suffer from chronic, care-intensive diseases at the end of life. Many households find it difficult to pay their health insurance premiums. Depending on their socioeconomic status, they may have unequal health opportunities, even in Switzerland. With its health policy strategy for 2020 to 2030, the Federal Council intends to further improve the system so that everyone in Switzerland can continue to benefit from high quality, affordable health care. Next, please. So this Health 2030 sets a framework for action in health policy, providing guidance for all health system actors. Health 2030 sets the framework. However, the success of the strategy also depends on the commitment of all other actors. It is thus important that everyone should be committed to the implementation of this new strategy. Next, please. So now you said we got the base of our healthcare system in a nutshell. Now let's see how Switzerland handled COVID-19. First of all, before I enter on how we handled it, we have to set a little bit of context. As I mentioned a few times before, Switzerland is a federal state with 26 provinces, which we call cantons, enjoying wide-ranging powers and competences in a variety of policy areas. Switzerland might be known for its natural beauty. It's also one of the most densely populated countries in Europe, with a high degree of domestic mobility. 70% of the Swiss workforce commutes to a workplace outside of their municipality. Many cross provincial borders to do so. Every day, 330,000 workers from neighboring countries, Germany, France, Italy, and Austria, cross the national borders to work in Switzerland. With some of the most important European transit routes passing through Switzerland, the number of overall daily border crossing amounts to 2.3 million. To be effective, the Swiss government's response strategy to fight the spread of coronavirus needed to take this reality into account. It did so by declaring an extraordinary situation, basically a national state of emergency, in terms of the Federal Epidemics Act. This step allowed the federal government to order the introduction of uniform measures in all cantons, effective effectively limiting provincial powers, a first for Switzerland, but one deemed necessary, considering the spatial density and high degree of mobility in Switzerland outlined already. Centralizing the COVID response at the federal level was preceded by a short but in-depth consultation process with the cantons and accompanied throughout by close coordination and cooperation with and among them. So let's see, we had the first case of COVID on 25th of February and the first community transmission on the 2nd of March. Up to today, we have 30,761 confirmed cases with a death toll of 1,915. But since mid of April, we have a slowdown of new infections as of mid-April. Hospital capacities never overwhelmed since this outbreak. We had, of course, measures like many other countries, like Ecuador also. We closed non-essential businesses, schools and universities, entertainment and leisure facilities, as well as restaurants and bars. Gatherings of more than 5 people were banned nationwide and strict physical distancing requirements introduced, applicable in private as well as in work environments. Contrary to many other countries, we had no curfews or blanket stay at home order for people without symptoms. Public parks have remained open for exercising, but distancing rules had to be followed. Domestically, no intercantonal travel restrictions were in place at any time. Through the public was strongly discouraged from traveling. Restrictions for entry into Switzerland were, however, introduced with exceptions for cross-border commuters, many of whom work in essential services, such as the healthcare sector or the pharmaceutical industries. Next, please. Oops. Sorry. So, as I already said, we had a very high, we were touched very much in Switzerland. And one of the measures we took quite early were the physical distancing and testing. Switzerland has one of the highest per capita rates of testing in the world. Now that Switzerland is easing, I'll go into it in the next slide then, we're easing our lockdown, but we are making sure that the testing has to go up and we are securing the supply lines for the possibility of procurement of personal protection equipment. Important to say is that none of the measures and actions taken by the Swiss government would have borne fruit had the public not followed them. Mobilizing an entire society to voluntarily restrict their freedom is a challenge for any leadership. Imposing restrictions on citizens who are accustomed to having the last say in the political decision-making process, as is the case in the Swiss system of direct democracy, is an additional challenge. The Swiss government met these challenges by communicating to the public regularly, coherently, transparently, with empathy, and based on the best scientific expertise and advice available. Through credible communication, unprecedented actions become comprehensible. It also laid the foundation for an informed debate and political discourse, which is ensuring now that the economic fallout of the crisis becomes apparent. And this is not only the case with us, but with everybody in the world, I think. So just as a last slide, I would like to show you that as a result of the lockdown introduced by the Federal Council, and because people in Switzerland have followed the rules on hygiene and social distancing, the daily number of the new infection has fallen. This means it is now possible to use contact tracing to contain the spread of the new coronavirus. A smartphone app will also be made available to help contain the spread of the virus. By combining the use of the app, conventional contact tracing, and respecting the rules, we hope to prevent the virus from spreading again. So now Switzerland is easing in a 3-phase strategy. The federal government defined the guidelines. We opened already on the 27th of April with the phase 1. But mainly the discussions were on the level of with the cantons and the private sector in developing safety concepts to implement this framework of reopening the economy and the schools. So this is very typical for Switzerland, a bottom-up approach to finding new processes in Switzerland, because we think that the industry, the schools, the employers know best how to run business operation in practical terms. So you can see on the slide itself that we opened 27th phase 1. The second phase was on 11th May. And now in June, we'll expect to open nearly everything. And even they discussed to open public events like football matches again to the public. Let me just finish with one phrase I read just minutes before the meeting in the Reuters article. But there will be lessons to glean from Switzerland's handling of the virus and subsequent quarantine, which has been surprisingly luxurious compared to the experience of many other developed nations. The takeaway may be as simple as this: societies that prize self-responsibility, respect for rules and institutions, and plan for rainy days are better places to shelter from the storm. So I hope I could explain you a little bit the system in Switzerland, and are open to questions. Sorry, I forgot to say next for the last slide where you could see the, here you only can see the measures we took, sorry. But I'm open for any questions, please.
Let me see. Yeah, thank you. Thank you. I don't know if we have any questions, Joshua, but I would like to start with a question about, you're currently in Ecuador, right?
Yep.
Yeah, so I'm not intending that you give an opinion on how things should be managed here in Ecuador, but in the last few weeks, we have seen some press or what is the general view from outside of Ecuador on what is happening here? It's just like, do you have because the U.S. Embassy, the Canadian Embassy, they were organizing repatriation flights for their citizens. It was the same advice for citizens from Switzerland, where basically you say, okay, you guys, you have to leave the country. Ecuador, it is under chaos, and because that was the perception that some, with a lot of messages we have seen on the news, social media especially. So what was the perception from the Swiss Confederation to what was happening here in Ecuador?
So first, I have to say that Ecuador handled the cases, the pandemic very well, and was very impressed how quickly they reacted. I think it was one of the first countries in South America to take the virus seriously and to take the measures appropriate. The problem is, of course, if the population are not following all the rules and didn't respect all the distancing rules, which in some cases is very difficult also. I think to live in Guayaquil as a poor family, I don't know, on 15 square meters or 50 square meters with a whole family of 6 persons, I think that's not easy to stay inside. So I have comprehended, but I think on the side of the government, they did a very good job. And of course, to see differences for the economy, it's very, very hard when you are already in a crisis with economic crisis, and then to help people, but really full of admiration how they did it. But Switzerland, we asked the tourists in the whole of the world to go back home if they wanted. It was not an obligation. We just told them that maybe it's better because the travel restrictions were coming up in world over in all the countries. So we told them that the ones who has to be back until summer, they better should take any opportunity to go back. Here in Ecuador, we had over 500 Swiss tourists who were without the possibility to go out. And we helped them to go back either with commercial flights at the beginning, with other repat flights from other nations, and we organized 2 repat flights to Switzerland, where we also could repatriate Ecuadorians living in Switzerland. We brought them back free of charge to Ecuador. And we also brought back Ecuadorians from Bolivia, because we had a shuttle flight from Swiss living in Bolivia to join our flight from Quito back home. So we took also some Ecuadorians from Bolivia. And one of our flights was going from here to Buenos Aires to pick up Swiss there. And we took Argentinians from Ecuador to Argentina. So I'm very glad to say that I think we all work together to different nations and helped each other out.
And my following question for that will be, as you as the spoken person, as representative of Switzerland here in Ecuador, there is any plans on, it's starting from June 1st, little by little, the activities will start reopening again to Ecuador. So there is any official information about when the nationals from Switzerland will be okay of coming back to Ecuador? I'm asking this because, you know, a lot of people from Germany, from the US too, from Switzerland, they come here as volunteers. They come here to do 1 year overseas and universities. So what is the vision on that? What is the perspective on that as well?
I think as soon as the country opens up again and allows international travel again, there will be Swiss coming back. So of course we have our volunteers, which many of them still stayed here. We still have, as far as I know, we have about 90 persons now still staying here, non-residents. And many of them are volunteers working in different sectors. Mm-hmm. But many of the people who were on the repat flights to Switzerland told me they come back as soon as possible. So I really hope. We have usually about 11,000 Swiss tourists here every year. So I hope that the big part will come back.
Yeah, that's good news. Thank you so much. Joshua, I think we have some questions for our panelists from Hospital Metropolitano. I don't know if Caridad or Monica, are you there? Because we cannot, yes, you are over there. Mm-hmm. So we have a couple of questions and we're running out of time. I would like to finish this as soon as we can, but yes, Joshua, if we can address these questions, please.
Very well. Very briefly, I saw that Monica answered Gian Mangia's question. Would you like to repeat your answer so that everyone who is watching can see that? The question was, do the hospital see COVID patients from provinces outside of Pichincha?
Well, my answer was that because of the restrictions that the country is right now, 100% of the patients that we have seen are basically from Quito. This week, some of the provinces are opening up their borders, and perhaps we will see patients from other provinces. But until Quito opens up or changes the street light from red to yellow, we will not see patients from other provinces because there is a restriction, really.
Mm-hmm. Thank you very much. Another one from Heather. It seems that only Hospital Metropolitano is prepared to handle COVID-19 patients, but as you mentioned, there is an interprovincial lockdown. What do you recommend for critically ill patients in other provinces to do for healthcare if they're ill from the pandemic?
Well, I believe that if they want to use the private system, I will suggest that they will select a hospital that within their province. We do have private hospitals everywhere. We do have private clinics everywhere. And if there are problems with the private system, the public system has established what they call sentinel hospitals. In each province and each city, there are sentinel hospitals. Some of them are big, some of them are small, depending on the population of the city. But there are means, as far as the public system, in which they can be tested. Okay, there are hundreds of laboratories, small, medium, and large size, as far as where they can be tested, and clinics and hospitals that they can be treated. And if, as I said, there are no private clinic of their choice, they should investigate which hospital it's called sentinel in that particular region.
Excellent. Thank you very much. And there is another interesting question. Just to remind us, because starting June 1st, flights will start to come back regularly to Ecuador, and there will be the rule that all of the people who arrive will have to take the PCR tests. How long do the PCR tests take in giving an answer or a result?
Well, if they are coming to our country, according to what I read, they have to take the PCR wherever they're coming from, and they have to bring the results and show them at the airport or the airline when they take the airplane. All right. However, in order for us to leave to other countries, I am sure it's going to be exactly the same. We should have a PCR test done prior to traveling to any other country. And that will, I guess, that will be accordingly to the requirements of each airline, of each country. I have no idea whether every single country of the world are requesting this testing. But I know we are, as Ecuador, we are requesting the results of the PCR. I really don't know if all the countries in the world are requiring this. I suppose, I really don't know, but Ecuador, yes. Ecuador is requiring this, and the testing cannot be done here. It has to be done wherever they're coming from.
Right. Here, if once they arrive, after 1 week in quarantine, they are required to do another PCR test. Yes. And that takes, you said at the hospital, 1.5 hours?
Yeah, in our hospital, the system and the testing that we are doing, it takes about an hour and a half, depending on the volume that we have. However, regular labs, which are authorized, because it is not all the labs can do this testing. The Ministry of Health has established a permit, an accreditation, a certification that we have to go through in order to do this type of testing. And they do have massive labs that they have authorized, and I understand they can take 24, sometimes 48, and depending on the volume, 72 hours.
Okay, thank you very much. And continuing what an earlier question about how to find hospitals outside of Quito. If you're not there, you can go to the Hospital Metropolitano. I'm sure Marcos and ECO-Assist will be able to help answer those questions. Recommended hospitals in any place, wherever you are. I think we're finished with that, Marcos.
Okay, all right. Well, thank you so much. Thank you, Madam Ambassador. Thank you, Monica. Thank you, Caridad. Thank you, Joshua. I just want to give a final message about what is Ecuador, since we are constantly in constant communication with the expat community from North America living here in Ecuador. We try to provide firsthand information, and also having a different perspective of what is happening within our borders, or as we spoke yesterday, what was happening in Colombia too. So we want to provide some information that it is useful for you. And believe me, the Ecuadorian community, the Ecuadorian people, they are grateful to have you here. And I hope what is happening right now will not change that, especially because of the healthcare system. We have the top hospital here, and I would like to ask Monica and Caridad if they authorize us to provide your email address so you can contact them if there is any further questions regarding some medical conditions, or some questions you might have about the hospital services, or any other city, because they're in that services, so they can help you probably they can help you with that. So that's all what we have to say today, and thank you so much. And we are preparing another event where we're going to have a representative from Quito Airport where they're going to be answering some questions about the new flights and starting from June 1st. So let's hope for that, and we will send you an announcement for that as well. Thank you so much. Have a nice afternoon. Take care.
Thank you all.
Thank you.